So you tore your ACL. Now what? Hey everyone, welcome back to another episode of Twin Stock Therapy. I'm Adam.
And I'm Aaron.
And together we have 30 years of experience in massage therapy, physical therapy, and athletic training. And today we're going to cover the ACL.
All right, so if you believe you just tore your ACL, you're first going to be seen by a medical provider, whether that's a certified athletic trainer, a physical therapist, or going to an orthopedic physician or an orthopedic surgeon to find out the extent of the damage. So Adam, do you want to lay on the table here? We'll kind of go through if I'm the athletic trainer, seeing the athlete on the sideline, or shortly after the injury in the athletic training room in my space. I'm going to first want to take a history. So I'm going to ask, how did it happen? How did the injury happen? So Adam, what happened? Tell me a little bit about what happened with your knee and why it's hurting you today.
Yeah, so I was playing a pickup game of basketball and jumped up from grab the rebound, and when I landed on the ground and I pivoted to go take off and running, and I just felt a loud pop in my knee, and it just felt unstable after that, and I couldn't finish the round of basketball. And if I try to change direction or stop quickly, it feels like my knee's going to give out. So
okay, so you're saying your foot kind of, was it planted and you felt like a twist as you went to change direction?
Yeah, like when I went to turn to run, I felt the torque in my leg, but it popped, and it's never done that before. So.
Okay, so what I'm going to have Adam do, go ahead and lay back on your back, flat on the table. And so I want to take a few measurements, check range of motion, check pain level, palpate or push around the knee to see where it's tender at, if he's having any pain. Check for maybe some joint effusion or swelling in the knee joint. So I'm just going to kind of check him and see if he can go to at least 90 degrees. If he can, that's good. A lot of times due to guarding, we start losing motion, and with joint swelling, we can get loss of range of motion as well. So palpating around, is that any of that painful? Do you feel any pain? Does it feel deep in the joint?
It doesn't feel painful where you're pressing. It's just when you're bending it, I could feel it in the middle of my joint, like a little bit of discomfort.
Okay. So oftentimes when we're worried about an ACL injury, we can have other structures that are damaged with the injury as well. So in addition to the ACL being ruptured potentially, you could have a sprain in the MCL, the medial collateral ligament on the inside, as well as a meniscus injury due to the mechanism of injury with a twisting on the knee joint. So the gold standard test for testing the ACL is called the pivot shift test, and this is what an orthopedic surgeon will do once the client is put under anesthesia and unconscious because of the guarding that the patient will try to do when you try to enact this test. So you basically want to recreate the mechanism of injury by grabbing the foot and externally rotating it, and then applying a posterior to anterior or pushing from the back of the knee forward to stress that ACL. Most patients are going to really guard against that. So the other test we like to do on the field is called the Lockman's test. And so I'm going to have Adam just relax his leg in about 30 degrees of flexion with the knee. I'm going to want his leg to rotate to the outside a little bit, and then I will stabilize above the knee joint, and the other hand will stabilize below the knee joint, and I'm just going to apply an posterior to anterior motion on his lower leg while trying to stabilize his upper leg at the knee joint from moving. If you get a lot of sliding or movement at the knee joint, that could be indicative of a ruptured ACL. The other test we like to do that can show a little bit more that there's movement or too much movement translation at the knee is an anterior drawer test. So kind of pushing posteriorly at the beginning of the test and then pulling with both hands. If you have your thumbs on the front of the knee joint and you can feel the bump of the tibial tuberosity, and you feel that tibial tuberosity really kind of come prominent and pronounced and feel like the knee almost slides back, then that also could be indicative of a ruptured ACL ligament. All right, so talking about the ACL or ACL rupture injury, ACL stands for anterior cruciate ligament, so just a little bit of anatomy to kind of explain where it is and how it functions. ACL runs from the front inside part of the knee joint in between your femur and your tibia, and it goes posterior lateral and connects. So it goes from connecting onto the tibia up and onto the femur in the back. And so it wants to prevent translation or the femur from sliding forward on the knee joint during athletic activity. It crosses the PCL, which goes in the opposite direction. So it's going from anterolateral to posteromedial. And so those ligaments cross, as you can see in the picture, and they form a cross, and cruciate is Latin for cross, so that's where it gets its name, and kind of the orientation anatomically of those ligaments and why the mechanism that we spoke of, that's the most common mechanism of injury for an ACL rupture, that's why it tears, is the way it runs in the knee joint and the motion it tries to prevent from happening, why it tears in such a fashion.
All right, so there's a few things we're going to talk about in rehab as far as after an ACL injury. Now, if you are not getting surgery, you would start the stuff we're doing now and just progress into strengthening. But this stuff can be done before you get surgery or whether you're getting surgery or not. So Aaron here is scheduled for ACL surgery, so he might be recommended for like 8 PT visits, physical therapy visits before his surgery. And our goal is to get as much strength built up as we can pre-op so that he doesn't have as long as a recovery post-op. So Aaron, I'm going to have you be the patient and lay down. Some of the things you will expect to do in therapy after an ACL injury is a towel slide is one thing. So I got a towel underneath Aaron's heel, and Aaron, go ahead, and that towel helps Aaron slide up and down without using too much muscle strength, because you don't want to stress that ACL. And so the towel helps slide up and down and work Aaron's range of motion without overworking his muscles. All right. Next, I could have Aaron pretend like he's pressing the back of his knee into the table. That's bringing the knee into terminal extension. And we're getting a quad contraction with that, so we're strengthening the quad. Because the last thing you want is the quads to atrophy while you're trying to protect it from the injury. So, all right, so we're wanting to get that terminal knee extension because we want as much range of motion to be able to be gained in the knee pre-op so that the recovery goes well. Again, you're going to progress in these things without, if you're not having surgery, you're going to progress continually until you feel stable enough to graduate from PT. But even if you're having surgery, this stuff is going to prep you.
And then so after the ACL repair, what do you start doing then as far as the rehab is concerned?
Right. So the first 0 to 4 weeks after surgery, you're in the protective phase. So our main concern is to protect that freshly reconstructed ACL because it's vulnerable, it's inflamed. You don't want to be doing too much crazy range of motion with it right away. Usually they're going to have a brace on, they're going to be using crutches, and so we're just protecting that ACL during the healing phase from surgery, because surgery is a trauma. Even though it's a planned thing, it's still a trauma. So you're kind of taking a step backwards after the ACL and starting from further back than you were in those pre-op PT visits. So we're mainly protecting. The most we'll do is range of motion, and then 4 to 8 weeks is going to be the strengthening phase. So we're going to start strengthening. You might have the PT have electrical stimulation on your quad to get more quad contractions, and you're really going to be working to 0 degrees extension, which is a straight knee joint. That's full extension or terminal extension. That's going to be the main focus, is terminal knee extension proves to be the better outcomes when people can get full range and extension.
All right, so in the previous scene, Adam explained how his knee injury occurred. So to just inform about the number one mechanism of injury for rupturing your ACL is typically when the foot is planted during athletic activity and you try to change direction quickly, usually causing an internal rotation of the femur and a lateral rotation or external rotation of the tibia, and that's what's going to stress the ACL and cause it to rupture, which can commonly be accompanied with an MCL sprain for the collateral ligament on the inside of the knee, just with that twisting towards the inside, as well as a potential meniscus injury to the medial meniscus in the knee, which is kind of that shock absorbing cartilage in our knee. So just because you tore your ACL, does that mean you have to have surgery? Adam, did you want to kind of explain if that's the case or not?
So actually, the British Journal of Sports Medicine just released a study in November of 2022, so just a few months ago, and they saw that 53% of ACLs healed on their own with non-surgical intervention, so just physical therapy, corrective exercise, strengthening. So even a higher percentage of ACLs showed repair or showed satisfaction. Patients showed satisfaction with quality of life up to 94% with non-surgical intervention after 2 years post-injury. The MRI showed healing, and of those patients that saw healing from a natural source, they were not up to 94% satisfied with their life going forward. So,
and these people that were in the study, they were younger kids, like the younger population.
Younger populations. So depending on how old you are, if you're younger or really old, surgery might not be the best ideal solution. But if you're a high school athlete and you want to make sure you get some sports seasons in before you graduate after your injury, ACL surgery might be the best option because it'll be the quickest path to secure healing and stabilization of that knee again. So.
Right, because if you're a young athlete trying to let it naturally heal, you could have a recurring mechanism of injury similar to the initial one, and it could just kind of start that whole healing process over. So you want to be careful if you want to treat conservatively and go the non-operative route if you're a young kid, just so you can properly heal that ACL. And as you get into middle school, high school with athletics, you want to still compete at your highest level. So you want to make sure you limit those stresses that could re-injure that ACL while it's healing.
Yeah, and that's important to keep in mind. That study showed that it was 2 years post-injury that they had their MRIs that showed healing. So it was a 2-year span after the injury, whereas the most an ACL rehab program goes after reconstruction is about a year. So that takes an extra year to heal naturally. So if you're trying to return to sport before your high school sports career is over, usually the surgeries are in that middle age group where people are either weekend warriors or athletes. They want to get the surgery. So.
Yeah, and I think the year mark is where they see the most significant increase in percentage of satisfaction and pain reduction and ability to return to formal activity. But you still have those last few percentages that kind of give everybody that full confidence that can occur up into the 18 months. So the ACL recovery is quite lengthy and requires a lot of patience. But next we're going to talk about whether you should go the surgery route or non-surgical route, whether you should do stuff before surgery or things right after the injury to help treat it conservatively.
All right, so again, 0 to 4 weeks after a surgery, we're in the protection phase. 4 to 8 weeks after surgery, we're in the early loading phase. So you're going to do open chain exercise, short arc quads, which is just having your knee bent a little. You'll have the patient kick their leg up to straighten it, working that quad. Then 8 to 12 weeks is the power phase where you're really getting into higher strengthening. And then after 12 weeks, then the athlete or whoever is having the surgery will work towards either return to sport or return to activity therapy, gearing them up for that. So,
and a ACL reconstruction surgery can be anywhere from a short to maybe 6 months if the patient just has great strides and great gains with the range of motion and strength and proprioception or balance, starting to work single leg stuff. It could be all the way up to a year or beyond that as well, just depending on how the patient responds and how they recover from the ACL reconstruction surgery. So it's a lengthy process, minimum of 6 months, typically up to over a year. So an ACL rupture, you're gonna be out for an extended time, and it's a slow build back to get back to sports activity or high physical activity if you're an athletic individual. But yeah, that wraps up this video. So as always, if you want to leave us a comment in the comment section below this video, drop us a comment or a suggestion on a future video at our email address at twinstalktherapy@gmail.com. And please like, subscribe to our channel, and click the notification bell so you get notified with new content.
And also, I just wanted to throw out there things that you can do to have your rehab go quicker. You can use red light therapy to decrease inflammation. We've done a video about that. You can also use the RPR drills. Those have shown to increase rehab time or completion to as much as 2 months earlier than a typical ACL rehab. And then we'll link that study from the British Journal of Sports Medicine in the description below, as well as some other links to red light therapy and RPR. So thanks for watching, and we'll see you next time.
See ya.